subscribe to my channel. Please subscribe. In this channel, we will upload different kind of subject about massage. There's anatomy, physiology, pathology, and our body. Enjoy learning our body. So please subscribe to my channel and hit the bell so that you are updated on all of our videos that we're gonna upload. Today, our topic is how to understand our client's pain. As a licensed massage therapy, it is very important that we are always understand our client's pain. Me, before I proceed or start in any massage, I first prepare the soap notes. The soap notes is a communication between you and your client. And a soap notes is also a communication between you and other healthcare professional out there. It can be a doctor, it can be a chiropractor, or it can be a physical therapist. Soap note, the first one is the S. The S is subjective, and the O is objective, the A for assessment, and P for plan. Subjective is a statement of our client or the complaint of our client or the purpose of their getting the massage. It can be location, it's where the pain was. It can be onset, when the pain started. It can be referrals if the pain refers in different place of their body. It can be duration, meaning how long was the pain last. It can be frequency, for how often the pain is felt. Is it goes in the morning or in the evening? Remember guys, as a massage therapy, we are not allowed to diagnose the pain of our clients. We just need to understand the pain of our clients so that we know how to help them. But we're not allowed to say what kinds of disease they have. Like example, our client says, I have a frozen shoulder. So we know that the frozen shoulder is if the person is having trouble with their abduction. They cannot abduct their hand. You're not allowed to answer them, yes, you have frozen shoulder. Ask them first, who told you that you have a frozen shoulder? Is it you or your doctor? And if they said, it's me, I just figured it out because my friend have a frozen shoulder and she cannot raise her hand upward, and it happened to me the same time, so I think I have a frozen shoulder. As long as the doctor didn't tell them that it's a frozen shoulder, we don't have the rights to tell them, to agree with them that they had a frozen shoulder. This list of those pain are some examples that the massage is indicated. The others are carpal tunnel syndrome, plantar fasciitis, sciatic pain, frozen shoulder, tennis or golf elbow, tendonitis, ankle sprain or ankle strain, adduction or abduction strain. Those pain examples are we can able to help as a massage therapy, especially when our subject is injury assessment. If we are not sure don't do it. We can help them by being certified on it, study on it by continuous education or CE course, and find some help of some of our friends as a guinea pig, and do a couple practice to your guinea pig until you learn how to perform it to your client. Let's understand the carpal tunnel syndrome. The carpal tunnel syndrome is the pain areas is in the hand and arm, and they feel it with numbness or tingling with some sensation like a pins or needles. Hand is become weak or painful. Is like too much repetitive motions, like example typing or texting. Something to do with the again and again movement of the hand. The muscle get tight around the median nerve through your wrist until to the palm of your hand. If it is neglected, it will possible into surgery. But if it seems early, as a massage therapy can help the carpal tunnel syndrome. This pinch of nerve, we can help them by relaxing all the muscle that related to the impingement of that nerves. Now let's talk about the frozen shoulder. The frozen shoulder is also known as adhesive capsulitis. The capsule of our shoulder joints become inflamed or thickened or tightened. The shoulder bones are unable to move freely, so they can't do the abduction. This is the adduction and this is the abduction. When the person have a frozen shoulder, they cannot able to abduct their hand. There is no 100% range of motion. If the range of motion is just like this, capsulitis is very thick. Who are the people who's getting the frozen shoulder? They said those people having a thyroid disease, those with diabetes, people with autoimmune disease, can be those people with stroke, also those people that having a heart attack, and most that the massage therapy can easily help are those frozen shoulder with a prolonged mobilization, like they work too much. It's also a kind of repetitive motion on their shoulder and arm, neck. Frozen shoulder can be helped with such massage technique. Joint mobilization massage. I use also the side-lying massage. We can put also some stress. And to help the frozen shoulder, our focus area is all the pectoralis minor, pectoralis major, and we're gonna focus also in all the four muscles that we call sits muscle, supraspinatus muscle, infraspinatus muscle, the teres minor, subscapularis muscle. Those are our focus area when person have a frozen shoulder. We're gonna help them to reach the proper range of motion. We're gonna help them little by little abduct the arms, the whole arms and shoulder. And now let's talk about plantar fasciitis. Even though the cause of plantar fasciitis is until now fully understood, but most of therapy practitioners said that plantar fasciitis is more common in some people that overweight or people between 40 to 60 of age, or runner, or a long distance walking, or ballet dancer, aerobic dancer, and also something to do in a shoes that not having a good arcs or support. Work that keep you on your feet for long hours. Ignoring plantar fasciitis can result heel pain that hinders you from regular daily activities. But some regular massage like cross friction will help our clients. It's very effective, and if we do the cross friction in our client's foot, we don't have to use lotion so that our cross friction will not slide. So as massage therapy, we can help plantar fasciitis. Doing some stretch, helping the plantar fasciitis to strengthen, and also do some breadcrumbs stroke. This time we'll talk about the tennis elbow. The tennis elbow is one of the repetitive motion that cause injury in our whole arms and elbow. So if the pain felt in the lateral side, this one, the lateral side, it can be tennis elbow. But if the pain occurs on the medial side, it can be golf elbow. To help the tennis elbow or the golf elbow, we have to find the exact pain of our client. So by putting some stretch towards the client, if they feel, like example, the pain there, they have to pinpoint the exact pain, and out of that pain, that is our focus area. Like if they pinpoint and there's a pain there, or there's a pain there, then when they pinpoint that, that is the one we need to put some multi-directional friction. Then we have to open all the muscles around it, then do some strengthening stretch with it, and always go back to the exact pain for multi-directional until the pain will subside. So the massage therapy is a big help to tennis or golf elbow. Now let's talk about the ankle sprain and ankle strain. The difference: ankle sprain is an injury to the ligaments or capsule of the joint. Ankle strain is an injury to a muscle or tendons. But both injury experience pain, swelling, limited flexibility, and range of motion. The sprained ankles occurs when the ligaments are forceful bent. Like the movement of our foot is like, if the movement is inward, it goes inside, it's inversion. But if the movement is outward, it's eversion. If the ankle will sprain if there's a sudden force movement occurs that beyond the range of motion of the muscle. then that's the reason why it's sprained. When the injury happened to the ankle, it needs to first do the RICE. RICE. R for arrest and I for ice. We have, especially it need ice when it's swelling. And C for compression. And E for elevation. The elevation should be above level of your heart. Can be, we put a pillow underneath it. The massage can be helped depending upon the grade of injury. If the pain and swelling is high, they need to seek a help of a doctor to make sure if clients need cast boot or splint or crutches. If ligaments tear, the massage also help by doing some multi-directional friction for where the pain was. This is the multi-directional friction. The reason why they call it multi because you can do it rotation, can be cross fiber, can be longitudinal friction. In this multi-directional friction, we help the ligament tear to heal on its natural way, to heal on its own. So we just help. Then we can do a little bit stretch so that will strengthen also the ligament or the muscle. If you are not sure, you can redirect it also to physical therapies. Example, if our client don't have a pain, is it important also to ask them what is their job? Different person, different pain, or different stress area of muscle. Kinds of security guard. It doesn't mean because they both security guard, it doesn't mean their pain is the same. There's a security guard that stand a lot. That is a different pain issue. But if there's a security guard that sit a lot, that is the call of their job, they sit the whole day, then that's different pain issue. That's why it is also important that we ask what is their job. Because most of the pain or stress muscle of the people is depend on what job they're doing. If they are driver and they drive long all the time, so the one that get stretched in their muscle is their neck and shoulder and arm, their lower back, and their feet for touching a guard. Understanding our client pain become relevant nowadays. Now, let's go back to our soft notes. After you learn the subjective of your clients, now it's the next thing is objective. It's your turn to do your observation to your client. Objection is an observation to your client posture and your feeling to their muscle in your hand palpitation. Then the next one after the objection is the assessment. Create the best possible treatment or help to your client pain. Help their range of motion. Postural assessment and record the result in the therapeutic field. If we don't write it, then it never happened. So as in a soft notes, it is included that we need to record the result. The last but not the least is the plan. After you listen to your client in the subjective and after you observe your client in the objective and assessing the client range of motion in the assessment, now is the time to plan. Follow up your clients to their next visit treatment, ask them if the time of duration, about the time that available for them, and continue the successful massage treatment for your clients. Our next video, we will upload how to take your hand, so that they can avoid carpal tunnel syndrome or tennis elbow. See you on next video!
Please subscribe to my channel.